and shine, Sleepy Joe, now's the time.
It's 6:20.
Breakfast at 6, tea's at 4:30. I'm not spending all my day in kitchen, I have pigs to feed. I said not to pull them right across, didn't I?
Sorry.
You can rest your head on the corner of your bed. You can watch the world go by. But you're never gonna see what the other people see if you're always gonna be a Sleepy Joe. Rise and shine, Sleepy Joe. There are places to go. There are windows to clean up the way.
Mr. Greengrass, what are you doing out of bed?
I was thinking of going for a 5-mile run. I'm looking for me clothes.
Your clothes are quite safe with me.
Look, all I needed were a good night's sleep. I'm as right as rain now, well, as right as I'll ever be.
I'm sure Dr. Ormerod will be delighted to hear that when he does his ward round.
Well, I'll be back before then. I've got to go to the station to collect someone, and it can't wait.
I'm sure it can. But if needs be, Mr. Hopkirk will fetch it for you.
I'm sure he will, but you see, I won't be long.
No, you won't, because you're not going. Come on, Mr. Greengrass, back to bed.
You don't understand,
Back
sister.
to bed.
Look, all I want...
Back to bed.
Oh, Joey, get down.
He's all right.
Tea's in the pot.
You don't have any coffee, do you?
What's wrong with tea?
Nothing. Thank you.
When you finish, you can wash up. Hot water's in kettle.
Right.
Morning.
Morning.
Sister Bridget said something about a package.
Yeah. Look, I want it brought straight back here, because I'm not supposed to let it out of my sight.
Oh, I'll see what I can do.
I'll make it worth your while.
No, you don't have to do that. Mind you, I might have to pay some more petrol money.
Yeah, I thought you might. Look, I've only got this foreign money because I had a bit of an attack on the plane, and then I had another one on the train, yeah, so I wasn't able to go to the bank. But if you take it round there, they'll watch it, change it.
Okay. Don't have any much.
There's only one thing about the package, like, I think it's best if nobody else knows about it, you know, because it's a bit, well, personal.
Trust me.
Yeah, you sound like a doctor.
What on earth is that?
Obviously not the Beatles.
Hold on.
Good morning, Doctor. Were you in pain?
No, I was in the bath. I forgot where I was.
You are in the bathroom that's reserved for use by patients. That's why there's a sign on the door saying patient's bathroom.
Sorry, matron. The digs I ran last night were like something out of the Dark Ages. I smelled like I spent the evening in a pub and then slept in a chip shop.
Well, I'm sure you've had more experience of that than I have.
Oh, I also came across a rather fine specimen of Semex electularis.
In that case, Staff Nurse Taylor will take the appropriate action.
Excuse me? I didn't recognise you without your stethoscope. Look, if you're looking for somewhere to stay, talk to Ken Kirk.
Oh, I did. That's how I wound up at Co-Comfort Farm. Any other suggestions?
Well, I should avoid mentioning bedbugs to matron, even in Latin. She's got a bit of a thing about them. Shall I take those to the laundry for you?
What?
Well, you've got to change, haven't you? Enjoy your bath.
You got it?
Yeah. I need a hand with this.
Oh, dear.
I think you might need a bigger trolley.
You wanted to see me?
Ah, yes, indeed I did. Come in. Please, sit down. Well, I've spoken to Jim Alway, and he won't be coming back for some time, I'm afraid. Possibly not at all.
Oh, dear. I did wonder when I visited him. He didn't look well.
No. I thought you'd like to know as soon as possible. So, that's one more of the old guard gone. Not many of us left now.
Oh, I'm part of the old guard, am I?
I'm sorry, that was tactless of me. I should have said longer-serving members of the staff.
I'm not sure that's much better. Though I suppose I am the longest serving. Next to you and Dr. Alway. I'll miss him.
We all will.
Right, Elsa.
Okay. Right, just let...
Oh, heck.
Oh, Alan! Oh, you've knocked the end of it.
Oh, what have you done? Here, get it up. It's a coffin. Well, I can see that.
What's going on, Ken?
Oh, patient up on Milner and Mr. Greengrass asked us to pick this up from the station. It's a coffin.
Well, the odd patient may leave here in a coffin, but they don't usually arrive in one. Get an undertaker to deal with it.
But Mr. Greengrass asked us...
Look, I'll deal with Mr. Greengrass.
Do you want me to phone the undertakers?
Let's not be too hasty, OK? This Greengrass has got a wad that thick.
Yeah, but Mr. Middleditch...
Yeah, Mr. Middleditch doesn't have to know. Here. Plenty more where that came from.
You see, the trouble is, Mr. Middleditch, that my sister's dying wish to come back to Yorkshire, and I promised her faithfully that I'd actually stay with her.
Well, I'm sorry, but we can't keep the coffin here.
Oh, you're worried it'll frighten away some of your customers.
It's hospital policy. I'm not even sure what the legal position is.
But I've got all the papers, you know, from Barbados. I've got the death certificate and everything. Well, your sister has in my suitcase.
This is North Yorkshire, Mr. Greengrass, not the Caribbean. We do things differently here, I'm afraid.
I'm sure you do, but when Isabel were on her deathbed, I mean, she begged me not to leave her side until she was buried 6 foot under Yorkshire soil.
Well, I'm sure she'd understand that things have changed since your illness. And I promise you that your sister is in safe hands.
Right, we'll leave it here till we know what's what.
Good bells, spoons full of diamonds. Good bells, spoons full of gold.
Just keep yourself still, mate. You'll be all right.
OK.
You'll be straight back for the other two.
Well, they look pretty bad.
Won't be long.
Come on, try again. Get this open. No, it won't. The fire brigade will be here any moment. Hey, look, relax. Seen it all. Well, we'll have her out any time. OK.
Nurse Hopkirk, can you bring the telephone over for Mr. Greengrass?
I've got to make arrangements for my sister's funeral.
Were you close?
Yeah, on and off. More off than on, but you know what they say, blood's thicker than water, but you'll probably know about that being in the trade.
Sorry about that. One in, please. Doctor, your lights are up.
There's a flat going in at Devon Street. What's that like?
Fishy.
Oh, you mean odd?
No, I mean, it's right by the dock. It stinks.
What have we got here?
Crash out on the Ashfordley Road. His lorry and a car.
What about the other car?
And his daughter. I went to the brigade to cut him out. I'm going back for him.
What sort of injuries?
And to say, the last one bad.
I could go and assess it.
No. It ought to be me, really.
Why?
Well, after what happened on your first day, I don't think that's very fair.
This time I'll have the right equipment.
Doctor.
Look, I need to deal with this. Go on. But call if you need any help. Mr. Middleditch wants it taken to the undertakers.
Look, what if the undertakers sort of make the arrangements, but Isabel can stop here just for a bit, you know, so she feels I'm handy if she wants out. You know what I mean, spiritually. I know it's going to cause you probably a bit of trouble, mate. So I'll tell you what. Look, let me make it with you. Yeah, mate.
Just hope I don't lose my job. Seeing its pressing family circumstances, she can stay for 24 hours.
Thanks, Ken. You've got a big heart. Mind, there's plenty of room for it.
Afraid it's me again. Proverbial bad penny. Are they still trapped in the car?
Yes. Can you do anything for the lass? She's in a real bad state.
What's her name?
Carol. She's 14. Her father's Robert.
I'll see what I can do. I'm a doctor, can I?
Yeah, better off around the other side.
All right. Hello, Robert. Carol. I'm Dr. Cherison. This is a bit of a mess, isn't it? Whoa! Hold it! Let's get some timber in here and get it chucked up. Can you tell me where you're feeling the worst pain?
My leg.
Okay, let's have a look. Step. Okay. It looks like you fractured your femur. That's your thigh bone. What I'll do is give you something that should take the pain away. It's just a quick injection. Okay. How are you feeling, Robert? Okay?
Fine. It's just my ribs.
How's the pain when you keep still?
Not so bad. It is when they move the car.
I have to do that to get you out.
It is really bad.
I won't be a moment. The girl's got a fractured femur. I can't see her lower legs. She could be losing a lot of blood. I need to get her out as soon as possible, or it could be bad.
You mean she could lose the leg?
She could lose her life.
Dr. Alway never fusses like this. He just gives me the repeat prescription.
Well, Dr. Alway's going to be away for a bit, and we all have our own way of doing things, don't we? Right. How long have you been having these pains?
Oh, it's been years, but it's just indigestion.
But you said it was much worse last night.
I suppose so. But, my husband and I, we've got this new business. It's a lot of hard work, so we're eating late and that. Doctor always says that probably sets it off.
Did you take anything for the pain?
I had some indigestion pills I get from the chemist.
Right, but they didn't make any difference?
No, that's why I came to see you.
Well, seeing as you're here, I'd like to run a couple of tests just to make sure that we know what's going on.
I don't see why.
Well, maybe we can come up with a more effective treatment for you.
Shall I make an appointment with reception?
No. No, we can do them today.
Oh, I can't.
Well, it won't take long, and I really think you should have the tests, Mrs. Attercliffe.
Spot of cramp there, Mr. Greengrass?
Oh, yes, yeah, and it's terrible. Because it's not just going up and down, it's going across as well, so I thought I'd see if I could walk it off.
You can fill this first.
I love an optimist.
As I went a-walking on Kildare Mountain, I spied Colonel Pepper and his money he was counting. I rattled out my pistols and I drew forth my sabre, crying stand and deliver, for I am a bold deceiver, mushering and down. Whack full of daddy-o, whack full of daddy-o, there's whiskey in the jar. The gold and silver coins, they look so bright and shiny, oh, I took them home straight away, and I gave
Sister!
my Molly. She vowed and she promised that she never would deceive me, but the devil's in
I know it's not your birthday, but would you like to take the sample?
Mrs. Attercliffe. Right, Staff Nurse Taylor, I'll take you through for your tests. OK.
It's a lot of fuss about nothing.
Doctor, we've some more casualties from a car crash due in. Do you really need that test done now?
Yes, otherwise I wouldn't have asked for it.
It's Sheila Attercliffe. She's one of Dr. Alway's regulars.
Well, it's a shame we missed the heart problem.
I'd be very surprised if he did. Dr. Allway doesn't usually miss much.
Well, the ECG should tell us.
I haven't half missed you. It's been ever so quiet since you went away.
Yeah, don't worry about it, David. I'm sure you'll make sure that things will soon be back to normal.
Well, you never said your sister was ill.
No, well, like a bit sudden, you know.
What did she have then? Is it like the same as you?
I don't really like to talk about it, David. Look, come here, I tell you, look, what I want you to do is to get the lorry, take it round to Casualty, and ask for a man called Ken Hopkirk. He's a short fellow with a big, and he wears a sort of brown overall, all right? And when you've done that, I want you to take this number, ring that number in Harrogate, and when they answer, just tell them that Mr. Greengrass wants to talk to them about the arrangements for the funeral.
Now, what about Mr. Scripps?
No, I don't want to involve him. She wasn't all that keen on him, you know. Did you bring the tools I asked you for?
Oh, yeah, they're in the bag. I've got a hammer, some pinchers.
Hey, David, you don't have to do a stock take. Put them in the cupboard. I'll take the whiskey. Not too much noise. There's people trying to sleep.
I'll take the bottle, thank you. The other one.
You should be working for MI5.
Merciful hour!
Good job.
Animal out of my ward. Go on with the both of you. Visiting hours for you are between 2 and 4, and the dog stays outside. Out! Mr. Greengrass, you are turning into what Matron calls one of those patients. When faced with one of those patients, sometimes the only option is heavy sedation.
It's not a bad idea. I think you could do with a bit of a rest.
Here, Carol, hold my hand. That's right. Okay, hold it. Okay, they've stopped. It's all right.
Doctor, isn't there anything else you can do? I mean, every time we move, it sets her off again.
I've given her another dose of morphine, but I can't guarantee it'll work. Can you get a message to the hospital for me?
Should be able to.
Can you tell them I need a cylinder of Entonox as soon as possible?
Entonox?
That's right.
Is that going to work? I mean, the injection's made no difference.
It's all right, Carol. It's going to be okay.
Right, this isn't good news, I'm afraid. The ECG results show that you've actually had a mild heart attack.
Can't have.
The pains that you felt in your chest, they weren't indigestion. They were what we call a coronary thrombosis, and I'm afraid that it's done some damage to part of your heart.
There's got to be a mistake. I'd know if I had a heart attack.
Well, heart attacks aren't all the same. It's not unusual for people to just have the sort of pain in the chest that you had last night, you see.
There's nothing wrong with me today.
There is. You're just not aware of it at the moment. The results show that your heart is in an unstable condition. So we need to do something about that.
Is there something I can take for it?
No. No, you're going to have to come into hospital. You need at least a fortnight's complete bed rest. That's the only way we can make you better. Your heart needs time to recover.
But I can't. I've got things to do.
Listen to me, Sheila. You could have another heart attack at any time. You can't pretend this hasn't happened. OK? Right, I'll go up to the ward and warn them that you'll be coming up.
Yes, well, you're very lucky, Mr. Green. I think that's just a broken rib.
Doctor?
I'll get an X-ray just to check that. Can you make a start by cleaning up those abrasions,
Yes,
please?
Dr. Cheriton wants a cylinder of Entonox. There's a girl trapped up there. She's in a lot of pain.
Well, he's going to need something stronger than Entonox.
And that was the message from the police.
Look, I don't suppose you'd take it out to him, would you?
I can't leave the department.
Oh, it's nothing we can't handle here. I think you're going to be more use helping Dr. Cheriton.
I'm sorry, Doctor, but if it's just carrying a cylinder of gas...
No. It's more than that. Dr. Cheriton's already lost a patient in a similar situation, and I don't want that to happen again. And you're an experienced casualty nurse.
I can't tell him what to do.
Well, I hope you're not going to have to. Don't worry, I'll square it with Matron. Go on.
Izzy, have you seen Mrs. Attercliffe?
I sent her in to you.
Yeah, but did you see her come back out again?
I'll check if I've got the notes back.
No, I've got the notes. I'm looking for the patient.
That's funny. We usually lose the notes.
I heard him say to bring Laurie round and ask for you.
Anything else?
To phone someone in Harrogate. What do you reckon he's up to?
I don't know. But if the organ grinder won't tell us, maybe we should ask the monkey.
You here for Greengrass?
Yeah, that's right.
Well, I'm Upkirk.
Oh, right.
He told me he'd given you the number of, what's his name in Harrogate. You haven't got it on you, have you?
Oh, yeah, sure. That's,
Yeah, asked me to give them a call.
What, about a funeral?
Yeah, but that's our little secret.
You wanted Entonox?
Yes, thanks. Just a moment.
What's the diagnosis?
Fractured femur and acute shock. I don't dare give her any more morphine.
He's going to put this jacket in.
I did think of trying a femoral nerve block, but I've only ever done one in theatre.
It could kill her if you get the artery.
Yeah. Thanks.
Can you reach the nerve?
I'm not sure. What do you think?
I think there's a young girl in a lot of pain.
Let's do it.
You're all right, it won't move.
Thanks.
I'm just going to cut away your skirt at the top here. Keeps on your school uniform, eh? OK, now the doctor's going to try and give you another injection, a different one. But he needs to reach the top of your leg here, right?
Right, Carol. I need you to be very brave for me. Can you twist your body a little towards me, Carol? That's good. That's
It's
good.
all right, now just hold my hand. Squeeze my hand.
That's good. OK, hold it there. Right, here we go. Ready? Good girl. OK. Now, all we have to do is wait a minute.
I had one of Dr. Alway's patients in earlier. Did you know that he had completely missed the fact that she had a heart condition?
Well, it can happen.
No, it wouldn't have happened if she'd been a man.
Jim made a mistake.
Yes, because he thinks that women fuss about nothing. You should see her notes, you know, they're so patronising.
Had he seen her recently?
Well, no, he hadn't, but even if he had, you know... Well, he's exactly the same towards me, isn't he? He'd be so much happier if I just stuck to mothers and babies and left the real work to the chaps.
Well, I don't think that's fair.
It's because you're a chap.
The patient's all right, is
I
she?
have absolutely no idea. I can't find her.
Thanks, nurse. Time for your X-ray, Mr. Greengrass.
Lovely. I was just wondering if it's not too much out of the way. Do you think we could go by the mortuary? Because I'd like to just visit my sister.
I think I might have to clear it with Mr. Upkirk.
My, yeah.
Thank you. I'm sure it won't be a problem.
It might be for me if this keeps up. Right. I hope you've passed your test.
Can you feel the leg at all?
No, it's like it's not there.
That's good. OK. All right, John. You going to tell me the real reason why you came out here?
Just couldn't keep away.
So you weren't checking up on me?
That's not my job.
No, it isn't. But thanks anyway.
When you have a moment, Nurse Hopkirk.
I'll have a long.
Where is Staff Nurse Taylor?
She's gone to help Dr. Cheriton.
Where?
Up on the Ashford Road. They're covering for her.
In future, if there's any covering to be done, you do not arrange it amongst yourselves. You come to me. Is that understood?
Yes, matron.
Your patient's waiting.
Mr. Middleditch, a message for you. Wrote it down.
Lizzie. This is in shorthand.
Sorry. Mr. Nisbet from Her Majesty's Customs and Excuses.
I think you'll find that's excise.
That's the one. Anyhow, he wants to speak to you about a patient called...
Greengrass.
How did you know that?
Sheila, I've got a hospital bed waiting for you.
Stuart and me, we're going to this big antiques fair in London. We can't miss it.
Is your health not more important?
This stuff's all the rage at the moment. It's our big chance. I have to risk it.
Well, have you spoken to your husband?
No, and I'm not going to.
Well, you should. It affects him too.
It's up to me.
Am I doing this on my own or what?
Oh, sorry, love. This lady was just looking at the grandmother clock.
25 quid.
Thank you.
For heaven's sake, Sheila, we're supposed to be in Portobello Road today, not next week.
If you'd like to have a think about it and come back, it's just that we're closed for the next couple of days.
All right, I see. Look, I can't force you to come in, but you need complete bed rest if you've got any chance of getting better.
I'll take my chances.
Sheila!
Oh, there you are. See you in a bit. He wants to see Coffin.
I bet he does. Did he give you any money?
Yeah. 3, 4, 5, 6, 700. Very generous he was.
No, half, yeah. He gave me 1,000. Oh, I took it to the bank. Altogether, it's worth about 3 bob. But the commission charge is £0.5 crown.
Oh, all this running around.
Don't worry. It might still pay off. Phone Harrogate.
Ah, Ken. Has that coffin been collected yet?
No problem there, Mr. M.
Is that a yes or a no?
It's a yes. That's temporarily a no, but me and Alan are seeing to it right away.
Then get on with it.
Prodigal returns. What have we got here?
Fresh and
Hello, I'm Dr. Ormrob. We're going to give you something to stop that hurting so much.
The doctor gave me an injection.
Femoral nerve block.
Really? A femoral nerve block. That was brave.
Well, she'd still be there if I hadn't tried it.
Even so, it was a hell of a risk.
What else could I do? I couldn't see the extent of her injuries. I had to get her out.
Yes. Well, it looks like you got away with it.
What do you mean it was the right thing to do?
Just so long as you weren't overcompensating for losing that patient before.
The difference from last time is I had the right kit. So I could do something out there. Instead of watching someone die.
Fair point. Anyway. Well done.
Not too cosy in here.
I bet you don't get too many complaints from the residents. Look, do you mind if I have a few moments with her alone?
No, you take all the time you like.
Thanks, Ken.
You wait here. I'll be back in 5 minutes.
Thanks. Did you find your patient?
Oh, yeah. She doesn't want to be admitted.
Oh, well, it's her choice.
Honestly, I don't know what's got into her. I think maybe the husband might be a problem.
Are you saying he might stop her having treatment?
Well, I'm not sure, really. Doesn't seem that sort, really.
How long's she been Jim Alway's patient?
Oh, forever.
Then I'll tell you who'll know all about her.
Matron.
Mm. Is that a problem?
Well, you know me and Matron, always been the best of friends.
I've got a message for Mr. Greengrass.
Do you want me to give it to him?
No, I don't think I'll better do that. It's about his sister, you see, and she's not at all pleased because she thinks that Mr. Greengrass has taken her spoons. Yeah, and she's not dead neither. But the other sister said that I can't go on to the ward.
What other sister?
Your sister.
I don't have a sister. I don't understand.
No, neither do I.
So what exactly is the message?
It's, will he please phone her?
Oh.
Perhaps I can help.
Yes?
Have you got a moment? I'd like some advice.
From me?
Yes, it's about Sheila Attercliffe. She's refusing to be admitted. I just wondered if there was anything I ought to know. I thought maybe the husband might be a problem.
Not as far as I know.
Sheila's not scared of him.
Of Stuart? She's devoted to him. Not surprising after what they've been through. You know about their son?
No.
A little lad called Daniel. He died here about 5 years ago. Meningitis.
How old was he?
8. This hospital doesn't have the best memories for her. I thought you would have known.
No, well, it wasn't in the notes. Well, there's no reason they should have been. Dr. Orway obviously knew.
I don't think it's Stuart that's stopping Sheila. Maybe she just doesn't want to let him down.
I wish I could talk to him myself. Anyway, thank you.
Don't let us stop you.
I just wanted one last look.
Oh, aye, and I suppose it's got nothing to do with you wanting a sample box of 25 for Messrs. Tubald and Fry, wine merchants and tobacconists of Harrogate.
Well, where'd they come from? Where's Isabel?
She's alive and well and living in Barbados, although she's somewhat brassed off at a best silver going missing.
Well, it wasn't all hers anyway. It was family silver, and I'm half the family, so I just had my half, that's all.
I don't know. What do you think we should do, Alan?
Oh, we could go to Mr. Middleditch.
Hey, that's not worth the paper it's printed on. No, I'm sorry. We can't be a party to this.
I didn't, honestly, I didn't like Barbados, and I don't get on with my sister, and in fact, she was the worst of the two. This was going to be my passport to get home, and then this firm in Harrogate promised me 100 quid for them.
500, they told me, but first you've got to get them there.
All right, well, if you help me, I'll give you 10% of what I get.
I was thinking more on the lines of 75.
You got more chance of knitting fog. I'd be losing money.
Well, I could just about go to 60.
All right, I'll split it with you, 50-50.
Done.
Yeah, I think you're looking at a fella as has been.
Yeah, they look fine. They should leave in no time. Might be off school for a while with that, though.
Hello, Carol. How are you feeling?
All right, thanks. Are you sure I can't have my leg in a pot?
No, we need to put you in traction. We'll have you dangling from the ceiling.
Staff nurse? Can I have a word?
Matron.
Where were you this morning?
I went out to the road accident.
Why wasn't I told?
Dr. Ormerod said he'd tell you.
It is not Dr. Ormerod's job to run errands for nurses. To leave your post is a dereliction of duty. How dare you?
I'm sorry.
Excuse me, matron. It was an emergency. If anyone's to blame, it's me.
It wasn't you who was supposed to be running casualty. If you value your job and you wish to keep it, you are not to leave this hospital without making sure that I know first. Do you understand?
Yes, matron.
Thank you, Doctor.
That was me thinking we'd done quite a good job. You doing anything this evening?
Looking for a new job at this rate.
Any chance you give me a hand house hunting? Seeing as you know your way around town.
Yeah, okay.
Great. See you after work, Meryl.
It's Staff Nurse Taylor, Doctor.
My light was up.
It's Mrs. Attercliffe. Her husband's phoned. He doesn't know what to do.
Right.
Excuse me. Who gave you permission to come onto this ward?
I'm Nisbet. Customs Investigations. I have a search
I
warrant.
don't care what you've got. You do not set foot on this ward without speaking to me first.
I'm looking for a Claude Jeremiah Greengrass.
Well, you're hardly likely to find him in the cabinet. If you'd like to follow me, I'll notify the hospital secretary of your arrival.
I don't like the idea of them going in here, you know.
Look, Alan pushes bins round the hospital all day and nobody takes no notice.
Hey, there's this bloke from Customs. He was in the ward.
Oh, well, come on, we better get our skates on then. The lad's outside with the van, is he?
Ready and waiting.
And you sure you can trust him?
Who, David? A bit more than I can trust either of us.
We're closed.
Oh, Sheila's doctor.
She's over there.
Right.
You were here this morning.
Yes.
So you knew Sheila was ill?
Look, can you get the car started? We need to get her straight to hospital.
Right.
It's all right, Sheila. Come here.
Sorry. I didn't tell you. Dr. Allway, he did warn me.
You should have listened.
Stuart, he needs me here.
Don't talk, Sheila. Not now.
Hey, I've got a job for you. You're a temporary, acting, unpaid porter. Cop hold of that. Follow me.
Mr. Nisbet?
Yes?
I'm Middleditch, hospital secretary.
I'm having difficulty discovering the whereabouts of one of your patients.
Ah. Well, Mr. Greengrass would appear to have gone AWOL. But given his condition, it's safe to assume that he can't have gone far. Nurse Hopkirk,
Yes, Miss Middleditch.
have you seen your uncle?
He's in the mortuary fixing something, I think.
Right, sir. If you care to follow me.
Okay, David, grab this. Yeah. Follow me.
Ah, Ken! Just the man. This is Mr. Nisbet from Customs and Excise.
Pleased to meet you, sir.
And he would like some help in tracking down Mr. Greengrass.
Well, glad to be of assistance.
Well, why don't you start in there?
The mortuary?
Well, you said you wanted to search the whole hospital, leave no stone unturned and all that. I'll leave you to it.
It's not very pleasant in there, you know. If I want your advice, I'll ask for it. Oh, my Lord. Well, I did warn you. It's a bit of a shock. Is this your first one? Yes. Is he a patient? Not anymore. I'm sorry. I'm not feeling very well.
Do you want to go and look at the operating theatre next?
Right there a minute. Go outside and check the coast clear.
Didn't I ask you to unblock the drain in the theatre scrub area?
I did that yesterday.
Well, it's blocked again.
I'll take another look. Won't be a minute.
No, you won't, because you're coming with me now.
Yes, matron. We'll have to go back and get the monkey bench.
What's going on?
Sheila's had a heart attack.
Well, I don't get it. Why were you at the shop this morning?
I think you need to talk to Sheila.
Yeah, but you knew she was ill. Why didn't you do something? Was it Sheila?
It would have been preferable if she'd come in a bit earlier, but the main thing is that Sheila has a very good chance of recovery.
You know, what's the same with our little lad, Donny? She kept saying there was nothing wrong. Kept pretending until... I knew she wasn't well. I was on and on at her.
Maybe it was just difficult for her coming back here, you know, after what happened to your son. More than difficult.
I can't lose her as well, you know. I can't.
Have you told her that? Maybe you should. I should be getting her onto the ward, you know. I don't think what he has to say will take very long. I was getting round to saying it that took the time.
Right, come on, Claude.
Where's he gone?
He's gone outside to get some fresh air.
Where are the cigars?
Well, Alan knows what to do, so don't...
Sorry, but I've got to go round to theatre.
Well, where's the cigars?
David's got the bin.
Does he know what was in it? Hey, what about me?
Hello, are you working here now?
Well, yeah, I suppose so, in a way.
That waste needs to go in the incinerator.
What?
The incinerator. Down the corridor, right, left, and left again.
Right.
No, left. Come on, I'll show you. See that thingy? That's the incinerator.
What do I do?
You'll work it out.
Yeah, but...
You've not seen David, have you? He's wearing a porter's coat.
Yeah, he was a bit confused, but I showed him where to go.
And where was that?
The incinerator.
Oh, no.
Yes, it was.
Get your foot down.
Oh, no, David, no!
Stop it, Ken! Do you know what you've done?
This is the right place, isn't it?
That peculiar smell. It's the new anthracite.
Really? I don't think we've been introduced.
Oh, this is David, maintenance engineer. He's here to fix the valve on that leaky pump.
And there is a good reason for Mr. Greengrass being in the boiler room?
Yes.
Enlighten me.
Yeah, well, it's because I'm missing the sunshine, you see. I've just come back from the West Indies, and as you probably know, in the West Indies it's always sort of hot, and you come back to England and it's always a bit cold.
And it's the warmest place in the hospital, isn't it?
Yeah.
I see. And the coffin?
It's going.
It's gone.
Well, that would appear to be that. Ken, would you see Mr. Greengrass back to the ward? However much he may be missing the tropics, I don't think Sister Bridget would approve of this type of ad hoc therapy.
Oh, hang on. Does this belong to anybody? Oh, in that case, I better take it. Coronas. Should make a good prize for the Christmas raffle.
Let's hope I can afford a ticket.
Have I seen you talking to Matron?
No, Matron was talking to me. It's the verbal equivalent of a radical testerectomy.
I thought you were walking a bit oddly.
You persuaded your patient to come in, then?
She didn't have much say in the matter. Apparently Dr. Allway had warned them months ago.
Well, so there was nothing you could have done?
Well, I could have tried listening a bit more and not been so fast to jump to conclusions.
Well, you could try blaming the patient for once. They're not always perfect. We've got an interesting case here. So, what do you say, Dr. Wetherell?
Well, I'd be a bit worried about what Sister Bridget's been feeding her patients. I don't know. Maybe she thought they were a bit short in iron?
Well, I'm afraid the screwdriver in your pancreas isn't your only problem, Mr. Greengrass. The urine tests aren't good either. In fact, the lab technician said they were fizzing. Slightly. But we needn't worry about that. With the level of sugar in your blood, you should be dead. All in all, you're something of a medical miracle.
Pleased to hear it.
But since your last set of clinical tests didn't go entirely to plan, well, we're going to just have to repeat them.
Well, why, when you already know what's wrong with me?
Well, we know about your malaria, your sugar levels, and your screwdriver, Mr. Greengrass. But they may not be the whole story.
Your clothes, Doctor?
Thanks. They've starched my underpants.
It's hospital policy for new doctors. What's the plan?
Well, I've arranged to see a couple of flats, and I thought maybe we could get a bite to eat.
Great. Oh, you might want to book a table.
Well, it's just the two of us.
No, 5. I thought between us we could sort you out. Hey, and then you can buy us all a meal.
Great.
I've just heard from Dr. Ormerod about a district authority inspection. Why does my hospital need inspecting?
Sister Bridget turned up this morning with a baby, that's all.
As in immaculate conception?
As in a carrier bag.
I didn't know what to do. I just didn't know.
Just don't get too involved, that's all.